Doctors Without Borders, MSF, would like to draw our attention to the fast-deteriorating mental health situation of refugees, many of whom have been living in camps. Hundreds of thousands of refugees are increasingly distraught at the lack of progress in finding sustainable solutions. A fatal mix of despair, anxiety and fear, combined with new uncertainties brought about by COVID-19 pandemic, is forcing refugees to take extreme measures. We're now joined by the Director of Communications at MSF Southern Africa, Borrie La Grange. Thank you so very much, sir, for joining us here on SABC News. We appreciate your time.
Thank you very much for inviting us.
You know, it must certainly be overlooked that many refugees are battling with mental illness, and I suppose that's because the focus is more on the other more visible, maybe more urgent problems, or perceived to be more urgent problems that they already have as refugees. Can you talk to us, please, about the mental health situation of refugees, especially those that are living in camps?
Yes, I think, maybe let's start off with just having a view on one of the oldest refugee camps around the world today. It's called the Dadaab Refugee Complex in Kenya. And literally hundreds of thousands of Somalis are still living in this camp 30 years after many of them have fled for their lives to reach safety in this camp. But the situation has deteriorated dramatically when we look at the mental health situation that the thousands of people face. So already at the in the camp, we run a 100-bed hospital providing primary health care, but then also we've started a mental health clinic. And in that clinic, what we're treating is patients who exhibit symptoms of schizophrenia, depression. Many have the anxiety disorders and also personality disorders that have developed. Now, I think we need to also see this in context that this is a population that has lived in incredibly harsh conditions for almost a generation now. So maybe I could just refer to two patients, people that we've encountered in the camp. So one is a 30-year-old woman, Fazia Mohammed. I'm going to read you basically what she has told us. She said, "How can you stay in a country for 3 decades and not know where you belong? You remain a refugee without any prospects. It has even greater impact on many youths in the camp who are hurting economically and socially. The rate of unemployment is very high, and movement restrictions could be removed, and then living conditions in the camp would really change." What she's expressing here is a feeling of feeling trapped, having no future, uncertainty about what will happen next, but in essence knowing that very little is going to change. And I think that's one of the conditions that through our experiences in Dadaab camp, but also what we can see among Rohingya refugees today in Bangladesh, and also among refugees who are in containment camps in Greece. We see the same thing, people with very little hope for the future, and this ultimately starts taking a toll on them because they don't see a future where things would get better. In fact, things get worse.
Well, that is really my next point. I mean, part of the problem with, I'll use depression as an example, and correct me if I'm wrong, part of the problem with depression is the inability really to see, the proverbial light at the end of the tunnel. And I mean, we often see this happening to people who have opportunities, who have resources, who have financial support, or who have their own finance. So I wonder what more the situation is for someone like a refugee, where it is an absolute reality, actually, because they don't know, when they'll be out of these camps, as you mentioned. So although with some people it might be perceived that they can't see the light at the end of the tunnel, but for refugees, it's an actual thing.
That's very true. I think the one thing that you point out is that mental health care, mental health challenges, we're becoming gradually more and more aware of these as a society globally. But what we have to recognize is that for many refugees, they come from a very, very dark place, having experienced massive amounts of violence, of trauma. Yeah. And this is something that they are haunted by. So, for instance, in the Cox's Bazar refugee camp, where 860,000 Rohingya refugees are still living, many of those refugees witnessed absolutely horrific scenes, having had their family members killed right in front of them, having had their homes burnt down, destroyed in a 2017 military clearing operation by the Myanmar government. So for many refugees, it's not just the uncertainty being inside the refugee camp at that time, but also the horror of what they lived through before. And not always having access to services or to care that can help them keep their heads above water. So as you mentioned, many of us potentially were able to seek professional care. We have the means to do so. We can move quite freely about. But for refugees, this is not the case, specifically in countries that have encampment policies like Bangladesh and also like Kenya, where, as I mentioned, the Somali refugees are still living in the Dadaab camp for now 30 years. So in South Africa, the situation is different. We do not have an encampment policy in South Africa, but it doesn't mean that people who are currently awaiting a resolution of their asylum seeker status or their refugee claims, they also suffer mental health consequences living with this uncertainty. And this is something that we definitely see in a project that we run in Tshwane, trying to offer access to healthcare for migrants and asylum seekers in South Africa as well.
There's still a lot of stigma around mental illness, even with all the sort of information that is available. I wonder if it is the same in these sort of refugee camps where you find everyone really in the same boat. Is there still some kind of stigma attached to those who are suffering with mental illness? And because, I would assume that a lot of people in those camps are suffering in some way or another, whether it is post-traumatic stress or whether it is trauma. I'm sure most people in those camps are already suffering from some form of mental illness. So I wonder, is there still, though, the stigma, or you don't see very much of that?
Well, I think we also need to understand that we're only able to have a conversation about mental health once we understand that experience is not normal. And when we see people who've lived through such absolutely horrific circumstances, it's very easy for them to understand that what they're experiencing is normal, that this becomes a normal, a baseline, that they then measure everything else against. And often the biggest task is really to sit down with people, to listen to what they have experienced and to try and find a way forward with them, but definitely for them to see to themselves and also to others that what they're experiencing is not normal, and that they deserve to be supported through this difficult journey. So the stigma itself, I think, is a more complex question, and it depends here on if people feel they're denied opportunities and whether their mental health care or the lack of mental health care could actually worsen their situation. So in this instance, camps, we do not see levels of inequality that we would say we see today if you were to live in South Africa. Everybody in a camp is dependent on food distributions, and also with COVID-19, these food distributions, particularly in Dadaab camp, have come under pressure. So up to 40% lower levels of food have been distributed in recent weeks by the World Food Programme because of the restrictions of COVID-19 in these camps. So in that sense, a big task for aid agencies, for medical organizations like ourselves, to help people to find the language to describe what they're going through, and also to have the capacity to do that. So in the Cox's Bazar refugee camp, where I've mentioned Rohingya refugees are still living, last year we conducted close on 60,000 mental health care consultations among the population there. Now, this is aside from the primary healthcare services that we offer. But I think as a medical humanitarian organization, we also understand that while primarily we're trying to ensure that people's bodies are healthy, that their immune systems are able to help them survive and stay healthy, we definitely also need to adapt our services in order to provide mental health care. And this is something over the last couple of years that we've seen as an increasing need, and we also have to recruit more mental health care professionals to work with us in these camp settings.
All right, thank you very much for giving us your time. We appreciate that, and certainly the work that you are doing that perhaps is often overlooked, Borrie La Grange. Thank you.
Thank you very much for the opportunity.